Hello. Welcome to another edition of Johnny Stocks 212. Other people trying to sell you something. I'm just here to find those A winners, go getters, trend setting companies to invest in. Thank you for joining me wherever you may be. We got a great show for you today. Today we're talking about an exciting biotech company, CTI BioPharma. So please read the disclaimer on your own time. So CTI, this company is pretty exciting. They got new medications for patients with, something I'm really passionate about, these blood-related cancers, which really don't have a lot of treatment options. They have a really good understanding of oncology and definitely the sense of urgency, which is incredible, what you want to see in these companies to hopefully move some of these treatments forward in these really awful blood-related cancer diseases. So let's look at the leadership team. Adam Craig, CEO and the interim chief medical officer. Bruce J. Seeley is the chief operating officer. So big fan of Adam Craig. I've heard this guy speak on a number of times. Really outstanding leadership team here. So if you research this company at all, they have this drug that's been approved, pacritinib, which is an oral, not given IV, oral multi-kinase inhibitor, which specifically for JAK2 and IRAK1. So it's really for diseases like myelofibrosis. And like other JAK2 inhibitors, pacritinib, it doesn't inhibit JAK1, so it's selective, which is really nice. Inhibition of JAK1 has been associated with a lot of different, immune dysfunction, lymphomas, and in some cases, some JAK1 inhibitors have been known to cause thrombocytopenia, anemia, which is low red blood cell count. So the unique mechanism of action, which is basically how the medication works, that's the mechanism of action. It inhibits JAK2 and IRK1 without inhibiting JAK1. Okay, that's a big deal, which hopefully it has shown in their trials that it's reduced cytopenia, immune dysfunction associated with a lot of other JAK inhibitors. Brand name is Vonjo for pacritinib. If you haven't, it got approved, I want to say sometime in February of 2022, the beginning of this year, for treatments with adults with intermediate and high risk for primary, secondary, post polycythemia, and basically thrombocytopenia. So some of the trials that they got going on, I'll go to some of the trials that they have going on, which is really exciting, is they still have this phase 1-2 trial going on for allogenic acute graft versus, which is basically prevention of, patients have basically they had to have a cell transplant. They have some type of transplant. This is specifically hematopoietin cell transplantation, and so far the trial data for the phase 1 looks pretty good. They still have other, they still have to report data from the phase 2 when it wraps up. I got to keep an eye on that. But this could be a new indication, potentially new indication. Also, here's another big one, myelofibrosis, which is basically the blood cancer. Phase 3 ongoing trial for severe thrombocytopenia. So that's severe thrombocytopenia. So another indication. So that's their pacritinib, which I've been talking about. They have another indication, phase 3 trial, which is really big deal. I mean, this is, a lot of patients, suffer from this. This could be incredible if it is safe and effective. Okay. Remember, myelofibrosis, that's a rare, really terrible bone marrow cancer disease. And it's basically affects your normal blood cells, okay, your normal healthy red blood cells, from creating scar tissue in the bone marrow. It can cause low blood counts, thrombocytopenia and anemia, weakness, fatigue, even enlarged spleen, which is really terrible stuff. So if they get approval for this could be a big catalyst, a nice catalyst, for this company. So let's look at the stock price. So CTI BioPharma, stock symbol CTIC, CTIC. At the time of the video, it's trading at $6.25. Okay, and I know what you guys are thinking. Yeah, but you've been in this for a while. I've been talking about since it's been in the dollars back in 2020, and I am going to probably unload some shares at this point. But doesn't mean I'm still a believer in the stock. I'm not getting rid of all my shares. I may buy back in. And the reason is I do think because of the economic situation we're in with inflation rates, potentially interest rates going up even more, potentially if Jay Powell increases interest rates, I think the stock could get hit a bit. I'm still a big fan. I'm still a big believer. I still like the company long term, but short term, I'm talking 6 months from now, I'll probably be getting back into this stock. And remember, I got back in the dollar range, $1.15, $1.25, back in 2020. So it's been, a couple years, and it has gone up about 600%. So which is a nice spend return. But I do think long term, this company's, got potential. I do like that phase trial coming on with the potential, they have one with the mTOR inhibitor, with combination with pacritinib, so that could be really good. That could be a big, boost if, could be great for patients. I'm going to continue to monitor this company because I do still think there's a lot of potential here for this company. That's all the time we have here for the video. I hope you enjoyed it. Please make sure you hit the like and the subscribe button. It really helps the channel grow. And as always, I hope you have a wonderful day.